without further ado, let me kick this over to both Crystal Lynch and Emily Christine from HealthWell Foundation. Ladies, take it over.
Thank you so much, Myra. Thank you so much for joining us today. My name is Emily Christine. I am the Manager of External Relations, and I'm thrilled to welcome you on behalf of my colleague, Crystal Lynch, who is the Senior Manager of Provider and Pharmacy Relations and just the HealthWell Foundation itself. First, I'd like to extend a sincere thank you to Myra and the United Porphyrias Association, who are a valued member of our National Nonprofit Alliance Partner Network. We're grateful for your ongoing partnership and commitment to supporting patient access to care. And of course, a big thank you to all of you attending today. We truly appreciate you taking the time out of your day to learn more about an exciting grant opportunity offered by the HealthWell Foundation. We know that your time is valuable and we're glad that you're here with us. So we look forward to sharing helpful information and answering your questions. So let's get started. The HealthWell Foundation is an independent 501c3 national nonprofit organization based in Germantown, Maryland. And that is just about an hour outside of our nation's capital in Washington, D.C. We are what's called a charitable patient assistance program. Charitable patient assistance programs provide financial support to individuals who are underinsured or facing financial hardship, helping them afford the medications, treatments, and essential health services they might otherwise go without. We aim to fill the gap where insurance coverage falls short, for example, by covering co-payments and premiums. It's important to know that charitable patient assistance programs are completely free and are meant to reduce financial barriers to care, especially those living with chronic or life-altering conditions such as porphyrias. The goal of our program is to be a vital safety net for patients, so we aim to help you to stay on treatment, avoid debt, and improve your overall well-being. We were established in 2003. And in 2024, we provided financial assistance through over 311,000 active patient grants. We're proud to say that 100% of donor dollars go directly to patient grants and services. Donor dollars never go towards fundraising or other administrative costs. And since our inception, we've awarded over $4.8 billion to more than 1.1 million patients across more than 1.8 million grants. So when I present the HealthWell program, I always like to show that we've been recognized by leading charity watchdog groups and publications. These groups evaluate nonprofit organizations like the HealthWell Foundation on factors such as transparency, accountability, financial stewardship, and commitment to mission. And we're proud to have earned their highest ratings because it shows that when you work with us, you're engaging with a trusted, responsible nonprofit that's truly focused on helping patients. It's important to us that you feel confident in who we are and how we operate, and we hope this reinforces that trust. So when health insurance is not enough, HealthWell fills the gap. We assist with prescription co-payments, co-insurance, and deductibles. So those can be governmentally insured patients like Medicare, Medicaid, TRICARE, as well as privately insured patients. Any form of health insurance is eligible. We also assist with health insurance premiums, specifically those that are Medicare Part B. And for some of our funds, we offer standard of care laboratory monitoring. That could be through blood and urine tests. We also offer vitamins and supplements, pediatric treatment costs, travel costs, and behavioral health services. So we know that 30% of Americans are concerned about being unable to pay for their prescription drugs, and our goal is to really alleviate that concern. So the way that we do that are through our disease funds. Since our inception, we have launched over 95 disease funds. You can see all of those disease categories here on your screen in blue. And in the middle of your screen, under metabolic disorders, you'll find Porphyrias. So while this presentation will be specifically tailored to our Porphyrias Fund, I always like to mention in presentations like this one that you are eligible to apply for more than one grant through our funds. So if you apply for a grant to treat your Porphyrias, you can also apply for another grant if you have that diagnosis. An example of that would be you could apply for a grant for Porphyrias, as well as if you have a condition of cardiomyopathy, at the same time, apply for a grant of cardiomyopathy. For each fund, we have designated disease fund pages. What you're viewing here is a screenshot of our HealthWell homepage. You can locate that at www.healthwellfoundation.org. And it will bring you to this page. And at the top of the page is a button called Disease Funds, which is highlighted here in red. Each page links out to a designated disease fund page. So let's take a look at the Porphyrias Fund page. We can see that the Porphyrias Fund, the status is currently open. There's a maximum award level of $4,000. There's no minimum copay reimbursement amount or minimum premium reimbursement amount. We do require a household income limit of 400% of the federal poverty level for this fund. The assistance types available are prescription drug copay or insurance premium Medicare Part B. We have an instant pharmacy card available. And then to the right in the white box, you can see all of the treatments covered. These are all FDA approved and compendia listed. So since 2006, HealthWell has awarded hundreds of grants to Porphyrias patients, and we're ready to support hundreds more patients in need. So I hope that at the end of this presentation, if you find that you may be eligible for assistance for a grant, that you apply through our website or call our contact center, which Crystal will highlight information on coming up. Just a little more about our premium assistance program. Over 90% of the HealthWell disease funds may be eligible for copay or premium assistance, and we just learned that Porphyrias is. That assistance covers health insurance premiums for Medicare Part B. And we'd like to offer flexible financial support. So we do give an option for a one-time switch from copay to premium assistance during an active grant period. Grant periods are 12 months. And if you have questions regarding, what may be a better type of assistance for you, copay or premium, our designated contact center can help you to answer that. So I'll turn it over to Crystal with how to apply.
Thank you so much, Emily. So yes, we're going to jump right in. I'm sure you're really curious now. Well, how can I access your programs? So we're going to explain that to you next. So when you are about to apply for assistance, there is some information that we're going to ask from you. So as a heads up, we created a checklist here of information that we're going to ask about. So that would be your demographic information, your health insurance information, your healthcare provider information, that's generally your prescribing physician. You will also need to provide us your social security number or tax ID and your diagnosis or disease name, as well as the medication that you're taking as well. So that's the information that we would need, and that will lead us right into step one is, do I qualify for assistance? And these are the general qualification criteria that we're going to go over for you right now. On each disease fund page, you will find specific eligibility criteria for each fund. But overall, as a patient, you're going to need some form of health insurance to qualify, major medical or prescription drug coverage. And we have helped patients who have Medicare, Medicaid, TRICARE, private, otherwise known as commercial insurance, as Emily mentioned earlier. You do need to be receiving treatment or having prescribed treatment for a disease that we cover. And the medication or product must be on our list of treatments covered. As Emily mentioned, we do assist with FDA approved and compendia listed treatments. Also, your household income would need to be within our guidelines, and you need to live in the United States or US territories to qualify, also need to be receiving treatment in the United States. So step 2 is the application process, which we've made really easy and simple for you. And we're going to talk about the ways that you can apply. So as a patient or caregiver, family member, you can use our website and go to healthwellfoundation.org and apply for assistance using our online application. We highly recommend that you start with that route. But if you prefer it, you're always welcome to give us a call to our contact center that Emily mentioned. Our phone number is 800-675-8416, and our team is available and happy to help you Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. Now, once you have completed an enrollment on our website or with our hotline team, then for re-enrollment, you can utilize our patient portal, and that is at healthwellfoundation.org/patient portal. You'll receive an invite for signing up for the portal once you have enrolled with the program previously, where it's a great one-stop shop to manage your grants and reapply. So just a little bit more about how we said that this is an easy and convenient way to apply. On the left side is another picture of our website homepage where you can easily go through the 5 steps to determine whether you qualify for the program. And once you've determined that, you can hit the blue button that says apply, and it brings you right into the online application. Again, our website is healthwellfoundation.org. And the alternative for applications for patients is to give us a call over the phone. And we have a team of over 180 highly trained professionals to serve as your first line of communications, whether that be for application processing or for any questions that you may have. So then that's calling our contact center. As a reminder, that's at 800-675-8416. So let's go ahead and jump right in to applying on the grant for a grant on the fund page for our online application. So Emily took you through this fund page and all of the information that will be helpful for you to know specific to Porphyrias Fund. If you scroll down, it'll give you information on whether you qualify. Some funds have a little bit of different information regarding that. Generally, qualifications are the same. So you can go ahead, and once you determine that you qualify, hit the apply button, and that will take you straight into the online application welcome page. And I'd like to mention that we do provide the application in English or Spanish. So if you or a loved one would prefer Spanish, we do have that option at this time. And right at the top of the application, you're going to let us know that either you are the patient and you're at least 18 years of age, or your family member or guardian applying on behalf of the patient. And then next, you're going to agree to our patient attestation. That is simply letting us know that the information that you're providing is true and accurate, and that you are agreeing to our terms and conditions, and you'll hit next to get to the next screen. And this is where you will go through the eligibility questions. So at the top, we have a message there about manufacturers. If you don't know, the manufacturer programs may be able to assist better than HealthWell Foundation can. So what we do is we ask you to make sure that you reach out to a manufacturer program to confirm whether you may be able to qualify for assistance with your medication that way. Or we know that if you have Medicare, you might not qualify for the program. So then you would go forward from there to select your disease fund. In this case, we selected Porphyrias, of course, and then the product, and we selected the product here, in this case, panhematin. And then you move forward to the next screen from here. And this is where you're going to indicate to us the assistance type. So for Porphyrias, we do offer copay or premium assistance. And for copay assistance, just as a reminder, that is for assistance on the cost of your eligible medications. And for premium assistance, we can assist if you have Medicare and you need help with the cost of your Medicare Part B premiums. For the sake of this demonstration, we're going to select copay assistance and go on to the next screen. So here is where we will ask you to complete a two-factor authentication. So you're going to enter your mobile number, which is going to send you a code, and then you would enter your code here. And the reason why we ask you to do this is simply for your own security and to protect your information. So after that, then we move on to the next screen. And this is where we get to the nitty-gritty of your information. So your name, your phone number, email, social security number, your date of birth, marital status, and gender. And then we're asking you to agree to receive electronic consent, because after completing this online application, we're going to provide you with the opportunity to enroll in our patient portal, which you can get your letters through there, and it is a really great resource for you. So we ask you to agree to that, and then we move forward to the next page where you're going to provide us with your insurance information. So all of your insurance information, if you have one type of insurance or two, but if you just have one, you just go ahead and indicate the primary type of insurance, the insurance company, policy number, and the subscriber name. Hit next. And this is where you're going to indicate your physician information. So your prescribing physician for the treatment that you're asking for assistance with, their name, phone number, fax. And then we're also always interested to know, how did you hear about our program? That's really important to us. And so we're going to ask you what the referral source is, who told you about us. And then we'll also ask your preferred language, English, Spanish, or other. And then you can move on to the next screen. So this is where you can have an opportunity to do just a final review on the information that you provided to us in the application. Just make sure everything is correct. If you need to update anything, you can just click on previous and it'll take you back to previous parts of the application so you can edit it before you submit. But once you're ready and good to go, you click on submit, and then that's it. That's the application process, and then you would be approved. So once you're approved, we would offer instant notification of approval. This application process, as you can see, it's really quick. Online or over the phone is usually less than 10 minutes. So you will also be offered, for copayment assistance, a virtual pharmacy card for instant billing. And I'm going to explain exactly about billing in the next couple of slides. But for opportunities that can't be billed on the pharmacy card, for what we offer is direct billing and reimbursement with providers, pharmacies, and patients as well. So a little bit more information for you about your grant once you're approved. So as Emily mentioned, the grants are for a 12-month period, and you are eligible to reapply if the fund is open, and you can do that up to 30 days prior to your grant end date. And again, grants are on a rolling calendar basis. So if you're approved today, then your grant will end 12 months from today. We do have a 30-day look-back period for each grant to allow submission of claims with the data service within the last 30 days. We know that you may have to have had treatment, you may have had to pay for it as well before you realize what the cost is going to be, or before someone has heard of HealthWell Foundation. We try to say, know us before you need us, which is why we're meeting with you today, but we do offer that just in case. And also, we have a 120-day timely filing option. So that means that when your grant period ends and you've reached the end date, you or your provider or pharmacy still have about 4 months, 120 days, to submit claims to us for the eligible dates of service from your grant period. As we know that sometimes there may be some delays with insurance or other reasons why, but that you can go ahead and still submit claims after your last date of your grant. Okay, and so now talking about submitting claims for payments. So I mentioned this HealthWell pharmacy card, and for copay assistance, it really is the best way that you can utilize your grant. It's really easy for if with your pharmacy, if you're receiving a medication from the pharmacy and you're needing assistance with the copay on that, pharmacy can run your insurance first. So that's what they will do, to run that electronically. And then they can run your pharmacy card information, member ID, and all of that as if we were a secondary insurance to cover your copay. In that case, you're not paying anything out of pocket. Your pharmacy is receiving the reimbursement immediately, and it's really the best way that you can go. So always know that the pharmacy card is your best bet. Now, we understand that there are some claims or payments that cannot be paid using the pharmacy card, or there are just some circumstances where the pharmacy card just won't work out. So we do paper billing, and we like it whenever possible for a pharmacy or provider to submit a claim on your behalf. So in this case also, so that you would not have to pay out of pocket, but that the provider or pharmacy will use our portal to send us an electronic reimbursement request form with your explanation of benefits or a pharmacy receipt, and then submit the claim to us. We have a really quick turnaround time of up to 7 to 10 business days, but usually much quicker to process claims and send a check out for reimbursement. Now, as the last resort, if you did need to pay out of pocket for your treatment, we will reimburse you as the patient directly. So you would be submitting the same documentation that your provider or pharmacy would send, but with that, we would just ask you to also include proof of payment. And we ask for 2 proofs of payment, which would be, for example, a register receipt and a bank statement. And so alternative ways to submit claims to us other than the portal is to fax to us at 800-282-7692. If you need to get our reimbursement request form and you're not using our portal, you can do that from our website forms page. And you can always mail us documentation as well at HealthWell Foundation, P.O. Box 489 in Buckystown, Maryland, 21717. All right, so now I'm going to go ahead and turn it back over to Emily to talk about some of our useful programs, tools, and resources.
Thank you, Crystal. So over the years, we've developed a range of tools and resources designed to make the application process easier and to ensure our support meets this full spectrum of patients' needs. So some of those tools that we've created are, as Crystal mentioned, the patient, provider, and pharmacy portals, the income checker and FPL guide, a medication search, the online application, which is available in English as well as Spanish, the HWF Assist chatbot. That's live on our homepage 24/7, as well as our patient mobile app for current patients. And I always like to mention our real-time fund alerts. So while the Porphyrias Fund is open and we can help hundreds more patients, some of our funds do close due to just volume and we need to receive additional donations for those funds. So while we're waiting on those funds, we have what's called real-time fund alerts. So you can sign up for a call, email, or text, and in real time, you will receive a notification that a fund has opened or closed. We also offer a dedicated resource page. This listing can be found in our About section, which is highlighted in red at the top of our homepage. You can see we offer resources like co-payment assistance organizations. Obviously, we are the HealthWell Foundation, but We, like to list the other co-payment assistance organizations, behavioral health resources, health services and government resources, patient support organizations like the United Porphyrias Association. They're listed within that tab. We have still some COVID-19 resources and information available, travel assistance, Medicare, as well as uninsured resources. And not shown here is our dedicated caregiving resource page, which can also be found in that About section. We do offer free patient brochures. These can be requested via email on our homepage, and also available in an e-version available for download on the homepage as well. And we also offer a 2-minute animated video where you can just learn more about how charitable patient assistance programs like HealthWell work. You can take the time now to scan that QR code and it will take you directly to that video, or you can look on our YouTube channel and you can find it there. And I hope that after this webinar, you'll stay connected with HealthWell. So we're constantly, offering news, updates, and resources. We do that through our quarterly Pulse newsletter, as well as our bi-weekly Real World Healthcare blog. Signups for these are all on that homepage that I keep referring to. Lots of information there on our website. And we also hope that you'll just follow us. We stay very active on our social channels. You can follow us on Facebook, X, Instagram, YouTube, LinkedIn, and Blue Sky. So here's our contact information. Thank you all so much for joining us today. We really, truly appreciate you taking the time out of your day to be here, and hope that the information shared was helpful as you learn more about HealthWell and how we may be able to help support you or someone you care about. I want to thank Myra again and the entire United Porphyrias Association team just for helping to make today's session possible. I believe we're now going to move into our Q&A portion. So if you have any questions, we'd love to hear them. I'll turn it back over to you, Myra, to guide us through. Thanks.
Thank you so much, Emily and Crystal. Wow. I literally just feel like we completed an application and some. That was really thorough. Thank you so much for preparing such thorough presentation. Not only does this represent, guys, our commitment as we have really shared our mission as UPA. We keep on repeating over and over again. We are committed to improving the lives of the Porphyria community. And here's yet another way that we are achieving this by ensuring that you have access to HealthWell Foundation. As they have shared, they have this open today for us to be able to take advantage of it. So why not improve the quality of life? I know stress itself, the financial burden, is tough enough as it is. So let's take advantage of this opportunity. Thank you so much once again for preparing such thorough presentation. We did have some people that joined a little later, so we have some follow-up questions. I'll just throw it out there and you guys answer whoever feels more comfortable, okay?
Sure.
So the first question: I have more than one medical condition. Can I have more than one grant with HealthWell?
Yeah, so I'll go ahead and take that one. The answer to this is yes. So you can have more than one grant through HealthWell. To clarify, it cannot be for the same fund, but you can have more than one grant within all of the disease funds that we have, as long as you meet those eligibility requirements and have diagnosis verification for all of them.
Fantastic. Wonderful. Thank you. Okay, question number 2. Do I have to pay back the assistance from HealthWell?
Oh, that's also another great question. So our services are always free. That's any charitable patient assistance program. So you never need to repay the financial assistance that you receive from HealthWell. Yeah, great news there.
It definitely is. Believe me, we don't we don't want yet another burden to deal with afterwards later on.
No, our goal is to really alleviate that financial stress so that you can just manage your health journey as best as possible.
Absolutely. Thank you for that. Okay, question number 3. Will I have to pay for medications first and then get reimbursed?
I'll go ahead and take this one. Great question. We do get that question often, actually. But as we went over the payment and claims information, your insurance will pay first, and then you can use the HealthWell pharmacy card that we spoke of to pay for that remaining portion of your medications. Now, if you do have to pay out of pocket for the medication, you can submit that claim to HealthWell for reimbursement after your insurance is paid. But our program is designed to make the payment and reimbursement process as easy as possible for the patient.
Absolutely. How thorough. Thank you so much. We do have some Facebook. This webinar is also being shared in Facebook. So if anyone from Facebook has any questions, please feel free to ask those questions as well. We're tracking that also. Let's move on to the next question. Do I have to use my pharmacy to call HealthWell? I'm sorry, let me repeat that again. Do I have to ask my pharmacy to call HealthWell to apply for me?
I'll take that question, Myra. So no, we provide options. Family member, a friend, a patient advocate can apply on behalf of the patient at HealthWell as long as they have the patient's permission. And as we discussed today, patients can apply for grant for themselves on their own. And in that case, also, I mentioned advocate, a family member, but your healthcare provider or pharmacy can apply on the patient's behalf. So as we touched on earlier, those applications can be completed online or on the phone, and we find that the majority of people who apply are healthcare providers and pharmacies on behalf of patients. They tend to be that first line of contact with the patient to inform them about the cost of their treatment and to inform them about assistance programs like HealthWell. So we really appreciate the providers and pharmacies who get involved and to, help apply for the patient and manage patient grants. Then they can also submit claims on behalf of the patient, which we always encourage for our providers and pharmacies, because that frees up the patient for other, time for to do other things, which we think is really important and
So
key.
important. And you know
Yeah.
what? I have acute intermittent porphyria myself. I have learned that it takes a whole entire army of professionals, not just the medical staff, but the pharmacy and really groups like yourselves and UPAs to give that sort of support so that we can have a better quality of life in general, because it's daunting and every single day looks different for a patient that has porphyria. So we cannot thank you enough that you have multiple partners, not just the patient itself that has to apply. So thank you for that. Okay, here's a really great one, and I'm sure that a lot of the patients out there are thinking about this one. I don't file taxes because I am on Social Security. Do I need to know my income before I apply?
That is a great question. So I'll go ahead with that one. To make the application process simple, we do not ask patients or someone applying on behalf of the patient to provide your income at the application process. So we will verify your household income through a third-party service on the back end while you're completing the application. And then we can verify your income that way. For the patients that we are unable to verify, most we can, but for those that we can't, as long as you meet the eligibility criteria, a grant will still be created for you, and then we will just request you to submit your income documentation to finalize your enrollment and access the grant funds. So for those of you that do not file taxes, we allow alternative documentation options. So for example, Social Security award letter, and other options as well. And our team can talk with you specifically about your income situation and what documentation you'd be able to provide. In those circumstances, we have a dedicated team specifically to answer those questions for you. So
That is
you can upload,
fantastic.
yeah, you can upload it on our portal, fax it, or mail it.
Fabulous. I'm sure that plenty of people were jotting that one down. Okay, let's move on to the next one for the interest of time. Can I apply for assistance with HealthWell if I live outside of the US?
Sure, I will jump in here. So HealthWell assists patients living in the United States as well as all US territories. So unfortunately, we don't, assist patients outside of the United States or US territories. I understand UPA is a, you know, international organization, but for HealthWell, we are just US and US territories.
Got it. Okay. And I believe you covered this already, but someone asked this, they must have joined a little later. Can I use the assistance HealthWell provides to pay for my health insurance premiums and co-payments?
Oh, so we do provide assistance to cover medication copays, coinsurance deductibles, or Medicare Part B insurance premiums. So most of our disease funds will offer both copay and premium assistance, and then you may choose one type of assistance for your grant. In good news, you can request a one-time switch during your grant period from copay to premium or premium to copay, if that will help you make the most of your grant funding that we have provided. I hope that answers that one.
So it is one or the other, but you can switch once.
Yes, if for one grant that you have, it's one or the other, and you can switch
Okay.
once. If you have multiple disease funds or diseases rather, and multiple grants, then that would be different. But for one grant, it's one or the other.
Okay. And the next question, when my grant ends, will I be able to reapply?
Sure, I can jump in there. Yes, and in fact, when I was looking at the fund report that we're able to just pull internally for Porphyrias, I noted that many of the patients that have received a first-time grant have actually reapplied over the years. So that's great news there. So yes, if you remain qualified, the funding is still available. You can always reapply within 1 month of the end of your 12-month grant period. So great news there.
Wow.
Yeah.
Really, this is something that, we live with porphyria and the likelihood of porphyria going away. As we know, we
Yeah.
don't have a cure. So having the ability to reapply really makes a huge difference. What a tremendous blessing, really, to have you guys. I just want you to know someone from Facebook just responded, not responded necessarily with a question, but simply said, "This is great information. Thank you for your presentation." So clearly, it's really resonating with our community, and it goes with our mission that we really want to improve the lives of everyone that's dealing with porphyria. I'll have two more questions, and then we will wrap it up. The next question is, can HealthWell help me pay for my hospital bills? This is a good one because I know as a patient myself, I've had bills outside of what my insurance can actually cover. So what's the answer to that?
So I can take that one, Myra. So kind of going back to that list of what we cover for HealthWell. So HealthWell does not assist with hospital bills, but we do have some advice for you on that. So if
Okay.
you cannot afford your hospital bills, we do recommend that you ask the hospital about their financial assistance policy, because most hospitals will offer discounts or bill forgiveness on income, and that's called charity care. So that was what we would recommend that you would do for your hospital bills specifically.
Look at that. I didn't even know that charity care existed. Great
Yes.
information. Hey, I'm learning a lot from you guys today. Thank you
Yes.
so much for that.
And I'll
Okay,
Yeah.
just,
last
Myra,
question. Yes.
sorry, I'll just throw in a little plug for our Alliance Partner Network here as well. along with the United Porphyrias Association, we have over 85 additional national nonprofit alliance partners, and a dedicated alliance partner page where you may be able to find additional resources to assist. So just a little plug in there for my role.
Wonderful. And do we just find that information on HealthWell Foundation or is
Yes.
there a specific page for that?
Yes, so under the About section where those resources were listed, you can find Alliance Partners, and that
Uh-huh.
page will populate.
Oh, fabulous.
Yeah.
I will be checking that out myself. Okay, and last question for today at least. A fund that I want to apply for is currently closed. When do you anticipate it will open again?
Oh, Emily, we get this question all the time, right?
We do.
Oh man. Okay, so right now we're definitely trying to get the word out about Porphyrias because we have plenty of funding that we need to get out to eligible patients.
That's great.
But it's not the case with all of our disease funds. As we mentioned, we have over 95 of them, and some of our funds do open and close periodically, and that is based on patient volume and available funding from our generous donors. So we are unable to predict when the funds will reopen as we rely solely on donations to open up that fund, but everything in our website is real time. So just another reminder to sign up for the real time fund alerts so you can receive notification about the funds and apply quickly. And you can get a notification on email, text, phone call, or voicemail to be informed right away.
I love that text feature. I don't know many places that will send you a little ping, hello, you qualify, free money, basically.
Yes,
Yeah.
exactly. Yes.
That's fabulous. Well, ladies, I can't thank you enough. I'm sure everyone that is listening, whether they're currently on Facebook, they're joining us directly from here on our Zoom. We're all grateful for you taking this time to share such information. It is important that because it goes along really with our mission as well, that we want to improve, again, the lives of those individuals that live with porphyria. And this certainly does. It's a tremendous way to improve our quality of life if we're not sitting there in tremendous stress trying to figure out how we're going to make the next premium payment or the next big co-payment for really expensive really medical. We only have few medical options, and those that do exist are really expensive. So thank you for making the time. I appreciate both of your guys' time. I appreciate everything that HealthWell Foundation is currently doing for patients around the globe, really, that have around the US, I should say, that have porphyria and other rare diseases as well. In the meantime, before I close, I want to remind our porphyria community about two upcoming events that we have. We have on June 21st a talk with a professional, a doctor, that is going to be discussing from molecules to medicine, the science of porphyria. And this is going to be really a class that we will be able to understand a little bit more about what happens in our body, be able to express a little bit better what really goes on, not just within our body, but also the different types of porphyrias as well. And the next one I personally am extremely excited about because it is a international symposium of porphyrias that will be occurring in October. That would be October 9th through the 12th, International Porphyrias Symposium. It will be in the DC metro area, specifically in Arlington, Virginia, my stomping ground. And I am super excited to be able to not only learn from the science aspect of it, but also there will be a lot of discussion about emerging therapies and an opportunity for us to have a global patient day. So we get to meet people from all over the world that have porphyria and be able to make the best out of really meeting so many other people. I have learned the best from other patients that have porphyria as well. So I'm personally really looking forward to this. And while we're there, who knows, maybe we can make a little stop with HealthWell Foundation while we're there. Why not? All
Yes,
right.
yes. We will
That would be
definitely
awesome.
participate in that day in some capacity, and yes, hope to meet you in person.
Thank you. Same. Well, everyone, thank you so much for your time. Truly appreciate it. Anna has been in our background. She is our director of communications, and she has ensured that this has been a smooth process as well. So I know that she's been in the background, but I don't want her to go unnoticed that this all happened because she made it happen too. So thank you so much. Enjoy the rest of this Friday. Enjoy the weekend. And once again, thanks for all the information, ladies. Have a
Thank
good
you
one.
so much.
Thank you so much.
Take care. Bye.
Take care.